we were playing with them. Okay, taking yet another angle on SNS planning, we have Karina Elsenblas, who is the Advanced Practice Center Program Manager for Public Health Seattle and King County, presenting when good information isn't enough.
Good morning, and thanks for the opportunity to talk about some risk communication strategies that we've employed in King County. And sometimes, despite best laid plans, good information wasn't just good enough for us. And so with that, I'd like to share some of our oops moments and how we turned those into opportunities to develop some tools to help us overcome those challenges in the future. I'd like to start with a question by show of hands. How many of you have had a response or an event that didn't go quite according to plan? Oh, some of you went really well. Awesome to see. Great. Not a lot of hands raised. Very good. Well, I'd like to share a moment when we did some translation for a hotline, and the Chinese hotline translation came back that it's a line that's hot. And so we thought some of our Chinese members weren't really into calling a line that is hot. So that led us to the development of some translation processes, because we know across the country, not only in King County, we're seeing more and more people in our community for whom English is not the primary language. So we started looking at the development of a translation toolkit to support that idea of you start with the material to the dissemination, and what is that process in between. And what is one of the key areas was, how do you begin to identify what languages are you translating into? Translation is very expensive, and you don't have time to translate into every language. So how do you prioritize that? So the toolkit talks about the identification of those languages by looking at data, school data, clinic data, in addition to census data. And we know in public health, we like to cram a lot of information on a fact sheet. And so this also becomes expensive when you think about translation and word count. So how can you be distilling that information down with images or comics to make the message much more succinct and available to your audience? Also, with less words, it's easier to translate and more cost-effective in the long run. But we also know it's not just about the printed materials, the fact sheets, but media. How are you effectively using media? Radio, TV, print. But for some of our communities for whom English is not their primary language, what are the other outlets, such as ethnic media outlets or community outlets? How can you be working with them in preparedness times for like a flu clinic? Building those relationships by buying ad space to advertise your upcoming flu clinic. So it's good to start building these lists in advance. And if you don't have a lot of ethnic communities, thinking about community newspapers to help support that message and building those relationships in preparedness times to leverage it so in a response they're covering your story. But as we've heard throughout this conference, it's really about relationships. It's about building those relationships now. We know risk communication is social communication. People in the community will be getting your messages, but they will be checking in with their family members, their loved ones, trusted leaders in order to verify that information before taking action oftentimes. So how are you building those relationships in advance and doing your community preparedness? I'd like to share a story of how we've kind of brought this together. In 2006, we had a winter storm. We had significant power outages. We had a significant number of carbon monoxide cases, and unfortunately, we even had some fatalities. We knew we needed to do better. So we looked at putting in a lot of these things into place, improving our translation processes, improving our relationships, particularly with immigrant and refugee communities who are particularly disproportionately impacted. And then, if we look forward to 2012, January 2012, we had a similar storm. We had power outages. But we had 10% of the cases of carbon monoxide. We had no fatalities. This is a picture from my area hardware store. I didn't go put those flyers up. It was our getting out to communities, and they were disseminating our messages. They were using the flyers that we had translated in advance through our translation practice and getting it out there. So it really is about building those communities, building those community partnerships, so that you're not just doing all the work on your own, but you've got messengers out there disseminating the information and helping to convey that information. So I just would like to give a plug for the Advanced Practice Center and a number of tools that exist, not only the ones that I've talked about today, but to support all of the FEP implementation, not just community preparedness or warning and notification. So thank you very much for your time.
That was wonderful, Karina. And finally, we have Ms. Cindy Lake she is the emergency planner out from Alexandria Health Department in Virginia, who is presenting on We Get a Little Help from Our Friends.
Good morning. So I'm going to share with you some SNS lessons learned today from Alexandria, Virginia, and what I'm going to share is part of why I believe we got a score of 100 on our LTAR last year. Now, Alexandria is a small city. We're outside our nation's capital with about 140,000 population packed into just under 16 square miles, so very densely populated. Now, our lessons learned, they really come down to two simple things. The first thing is passion. We're all passionate about what we do. That's why we're here. We care about the health and well-being of our communities, and we want them to be prepared. The second thing is friendship. We all build relationships in our communities. That's the key to public health preparedness, is collaborating with our partners. But I suggest that we take that one step further and actually create true friendships with your responders and other agencies. Passion and friendship. These are two things that are not easily measurable, especially not on an LTAR. But I do believe that these are things that can help you advance your SNS planning. Use your passion to create those relationships. There's an energy that comes behind the passion about what we do, and use that to create those friendships. So how exactly can you do that in your community? Live in your community if you can. I know that's not always feasible and affordable, but if you live in the community, that's your home too. So you are a stakeholder, and other residents and agencies that work with you will see that. Volunteer in your community. There are always plenty of volunteer opportunities out there. Even if you only do an hour a month or an hour a week, you can go to a homeless shelter, mentor a child, work at a museum. I volunteer in my community as a first responder with the fire department. So not only does this give me credibility with other first responder agencies, not just fire, but police and sheriff and other agencies, because a lot of times public health has not always been viewed as a first responder. But when they see me and know that I volunteer, they know that I get it, that I understand it. And how can we ask people to join our Medical Reserve Corps and support the health department in an emergency when we can't even take the time ourselves to volunteer in our community? And it's also part of giving back to the community. The other thing, show your face as much as possible, even to the point of people saying, why is this person always showing up to these meetings? But I think it's really important to always try to attend meetings in person, because people will recognize you, they'll know that you care, and you get to know people. People have a lot harder time saying no in person, whereas you give them a call or email them, it's much easier for them to say, no, I can't help you. But when you show up in person, they realize that you care. And I get that all the time. They're like, there's that public health person showing up at this meeting. And again, back to the emergency response. It's important for us to be at the table with fire, police, and the other responders so they know that public health has a seat at the table. Another thing, I mentioned this earlier, make friends with the people that you work with. Now, you're not going to be best buddies with everyone, and totally understand that. But get to know them personally. Ask them about their family, what they do on the weekends. This is our What is Public Health campaign. Law enforcement is public health. Grab lunch once in a while. Don't make it all about work all the time. And an example in Alexandria that may sound a little cheesy, but it's just one of those things that happens. I was helping to teach a CPR class, and we had MRC volunteers come in, and I hugged them in greetings. And we do that at city meetings. If you haven't seen someone for a while, you might give them a hug, and it's just normal. And I know it sounds kind of like the touchy-feely stuff, but that's what it is. It is the community, and I think that's what makes us a great community. Now, at our LTAR review last May, that feeling of friendship was evident in the room, and it was definitely clear to the reviewer when he came in, because everyone showed up early. It was not a business meeting. You know, you go to a business meeting and people are just kind of like not really talking at the beginning, and everyone's all suited up and professional. And this was more, it was old friends kind of getting back together. And the reviewer saw that. The reviewer commented on that. And while there are many other reasons I think that went into our LTAR score, this was a big part of it, that he could sense that community. So my suggestion to you is ignite your own passion in your community and use that energy to establish your friendships for SNS planning. In Alexandria, we pride ourselves on our close relationships, and those have prepared us for anything, whether hurricane, earthquake, H1N1. Excuse me. Those same relationships I've highlighted for SNS planning came together recently following a very tragic event. We had a line of duty death in our fire department and lost a very close friend and colleague. And everyone came together to support that in our time of mourning and loss, thanks to these already established friendships. Thank you.
So, Cindy was the bookend for our presentation, and we have about 10 more minutes left. If people have any questions for our presenters or anything at all, I'd like to use our time if anybody has any questions. Comments? Does anybody want to try this format?
Oh, I don't need it.
Okay,
Cindy, what would you say is a good strategy when you break the trust of a friend?
Admit that you're wrong. And that's a challenge in a small community. I had this conversation with one of my counterparts in Arlington that I always want people to make sure if they don't want me to say something about what they're about to tell me, they better tell me that. And I say that to my friends all the time. If I know that I don't want something shared, I say, you cannot share this. And I say just admitting that you've done wrong and keeping that open communication with people.
Thank you.
Sure. There was another question somewhere. Maybe they left.
No, I agree with you wholeheartedly about volunteering in your community. It makes it so nice. I know so many of us get so busy with our kids and our grandkids and everything else, but it makes a huge difference, you guys. Huge difference.
When I first started, I actually started as the MRC coordinator, and I hadn't ever volunteered. I'm ashamed to say I'd never volunteered in my life. And I remember doing an orientation and thinking, how can I talk to these people if I've never been a volunteer myself? So I've learned it.
Sure, go ahead.
Yes, for the gentleman from Georgia County. Sorry.
Great.
Well, I don't know. So I noticed on one of your slides for the MOU with the federal partners that you did not use your own MOU template, but that of Kansas City. So I was wondering if that means that you use a similar model to what they did. Did you, with your federal closed pods, did you have a single MOU for all the federal agencies, or did you have to have individual MOUs with each of the agencies?
Let me address that point by point. First of all, can everyone hear me okay?
Yes.
Okay. Melissa, can you hear me okay? That's Melissa Dunkerson back there. Let's give her a round. If I'm turning red, you're turning red. First, the MOU picture that you saw up there was the first capture we could get off of the internet, where we Googled the words MOU and SNS. So to me, the point was more about not the specific minutia detailed in that MOU, but rather the fact that you really do need an MOU, really do need that commitment before moving forward. And it's commitment on both ends. So that in regard to the MOU, yeah, you spotted what was up there, and that's impressive. And I will tell you this. In regard, second part of your question, in regard to our federal entities, we use a separate MOU for each one. And there are certain entities that do similar things. I've spoken to a lot of people at the conference, and I know that there are actually state and locals out there that don't, that actually have one broad MOU. We just found it a lot easier to utilize an MOU for each one of them. It also actually solidified their commitment on some level. So I know when I used NASA Goddard, that center, their medical director was very, very happy to be a part of the closed pod effort, whereas other federal entities, it took more convincing. So, and we were actually advised by our state to utilize a different MOU. The same MOU template, but not one broad MOU for all.
So there wasn't a lot of variation in the terms between the different agencies?
Not even words. Thank you. Melissa, could you hear me?
Yes, sir.
For Justin, since the IMAP has been released, have you looked at the ability to interface your inventory management system with the CEC system?
I would be very happy to interface with any state or federal system. No, we haven't been approached, and we haven't approached them yet. So Massachusetts just released for a few people on the public safety side an inventory management system that is strangely very, very, very similar to the one that we launched. But they don't communicate, so I'd be very open to it. We hope to not have little islands of inventory management, because the way the system that we designed works, it's sort of a social network of inventory management. So I can have another state or another community or another agency or another department all sharing what they're willing to share within an MOU. So I can search for COTS and see all COTS that are available within the program, basically. So the more we can connect with other systems, the better. I guess.
Anybody else? Did you appreciate the format? Yeah. Higher ups that are in the room. Keep the tradition going, so it's great to hear. And maybe we move it to an evening format. You all can be less tired at the end of the session. So if that's it, go to the